You know, they say that the eyes are sort of the entry into the soul. And when we look at people, we look them straight into the eye. And sometimes that's where we first see the signs of aging, because when you look at someone else, you're looking at their eyes. And that's what bothers patients. So that's one of the primary areas for facial rejuvenation. And, you know, there's the upper eyelids, and then there's the lower eyelids. What bothers people about the lowers? Usually it's puffiness. And what is that puffiness? That puffiness actually is fat, usually. Not because the patient is fat, but because the eyeball is in a bony socket. It's in the skull. And if it were to be injured or pushed on, it needs a nice soft cushion. For some unknown reason, that fat that's protecting the eye bulges out with time. And so the lower eyelid operation usually removes some of that fat that's there that bulges out. And then we usually also resuspend the tissue under the eyelid so that it looks less excessive. In other words, when people smile and they see wrinkles around here, this operation is able to reduce that. It's not a wrinkle operation. It's mainly a redraping operation or removal of fat, but it does improve that look on the lower eyelids. Now, the uppers, sometimes we get extra skin. You know, we're opening and closing our eyelids every day, countless times, and that stretches this extra skin. So we often have to trim and remove some of that extra eyelid skin that's there. Sometimes it gets to such an extent that it actually droops over the eye and causes visual impairment. And so we can make the vision sometimes better, not by affecting the actual sight, but by getting rid of the drape that's fallen down over the eyes. Now, sometimes it's not extra skin here that's caused the problem, but actually the brow has dropped down. And so instead of removing skin here, what we do is to elevate the brow to open the eye. And then that is a brow or forehead operation or suspension or lifting procedure that we do. So we have to totally evaluate all that's gone on around the eyes that gives it the aging look. Patients often say, you know, I feel vibrant, but everyone's always asking me, am I tired or am I cross? And sometimes that's because, you know, everything has descended down, either extra eyelid skin or the brows have come down. Sometimes it's because the muscles here are become overactive, and that's when we can use injectables such as a Botox to soften that. Sometimes when we do the forehead lifting, we actually work on this muscle here to relax it also. So a lot of considerations for the eyelids, a lot of things that we can do so that when one is looking into your soul through your eyes, they don't see an old soul perhaps because of an old look on the outside.